they will probably start by saying, can you tell us a little bit about yourself?
I just graduated at university with my BSN degree, and I also passed the NCLEX on October 2022. And before nursing, I did some work experience as a registered dental assistant in a pediatric and adult dental clinic. And I also did some volunteer experience in a senior residence facility. And also, I did my senior preceptorship at emergency department. So what I love about is that first, they're a magnet hospital, which means to me that they are very high on nursing excellence and high quality patient care. And I personally witnessed the work culture inside the healthcare team. They're very welcoming, they celebrate diversity, and they're very dedicated and committed on providing best patient care for all the patient, regardless of who they are. And why surgical nursing? Because I have an experience when my family members has been in the hospital after their heart surgery, and I experienced there how warm and how very comforting those nurses. And one time I also had my granddad who passed away, and I experienced the warmth and the comfort of the nurse had given me, even though I wasn't the patient. I felt very supported, and I felt that I wasn't alone. So that's what really makes me pursue my nursing career. Thank you.
I love it. I think some extra things. So the way you worded it was perfect. You can add, because you were saying they provide the best quality care. You can say the best quality evidence-based care,
Definitely.
because they are so into evidence-based practice. They ask a specific question about it later. So if you can put that word in the beginning, they'll be like, oh, she knows what's up. They also ask a question sometimes about family-centered care. So if you can throw that word about how you really respect their emphasis on family-centered care, and you were able to experience that when you had your friend's dad in the hospital, that kind of thing, put in the words evidence-based care and then family-centered care, and they'll be like, oh, she speaks our language. She knows. She's ready to go. I think that's actually really good. Most people really struggle with that question. I think that was perfect. Another really common one they ask is, tell us about a time when you provided compassionate care. So you want to leave them with a super sweet image of you with a patient where they're like, oh my God, we need her. Our patients need her. That's so sweet.
Yeah. So I have a couple of stories, but I want to share you this one. So during my rotation, I have a patient who had, but then one day I came in his room because I was about to walk her around the unit. So that's my job during that time. So and then I noticed that she was sitting on her bed, and she said, I don't feel like walking today. And then said, oh, what's up? I told her, are you okay? Is there anything wrong? And then she told me, well, it's my daughter's birthday today, but I wasn't be able to be with her, and then it's not gonna be here with me today too because she has to take care of their. So it's like, at that time, I feel bad for her. So I said, is there anything in particular that you want to do right now so to make you feel better? And then she told, well, I want to see, but then her phone doesn't have a charger, so she cannot call them on FaceTime. So, well, for me, because even though I'm not allowed to use phone, I always use an extra charger on my backpack. So I told her, well, let's do this. What about I'm just gonna grab my charger very quick and let's charge her phone, or um, if it's okay to you. And then I also asked my nurse preceptor because I'm not sure if I'm allowed to bring my own phone charger. So I asked my nurse preceptor if I can do that. So at that time, so she lightened up and she told me, oh, that would be very helpful. So what I did is I grabbed my charger and we charged her phone. And then I also noticed that her hair is like, um, when you're always lying down and your hair is like all messed up. So I told her, would you like me to brush your hair so when you call you'll be more put together? Said, oh, that would be great. I also brush her hair, and she was so thankful, and we managed to call and sing happy birthday. And I even made like a little, when you blow the gloves and you make a little balloon and you put smiley face, and we used that one as like a fake balloon for and then, well, the outcome of that is that she was very happy because she was able to talk her and to And she's kind of teary-eyed because she didn't imagine that I would go the extra step to like even fix her hair so she can look put together when she's talking to her family. Sorry, I'm kind of teary-eyed while talking to that.
Aw.
Yeah.
Say one more sentence that bridges it forward, how that'll change the way you approach your other patients.
So with this experience, I learned that how little kindness go a long way when you actively listen to your patient. And as a nurse, it's very important to actively listen to your patient and show them compassion, because for us it's very routine. The work inside the hospital is very routine, but for them this is something new. And most of the patient don't have any like family members who can come in and visit them. And being compassionate and listening to them, make sure that even though just a little act of kindness, it goes a long way and it means to them really much.
Oh, the story is beautiful. I love it. I love
Yeah.
it. When she was in better spirits after everything you said, did she walk after?
Yeah, she walked
I
after
could see
that.
that. Yeah.
Yeah. So we
Because that's
basically
your
talked
medical intervention, right?
yeah. So we basically talked over the phone first, and then after that she walked on the unit.
Oh, okay, good, 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 good. Okay. Another super common one they'll ask is tell us about a time you had a difficult patient.
This was during my rotation. I had this patient, so she wasn't really able to like walk around without assistance, and sometimes she's on the wheelchair because she really cannot move the leg right away. So one time, I heard her like shouting, screaming, and even like when they about to give him medication, he doesn't want to take the medication, and he was just like very upset, agitated, just like just screaming. And then, but I had this patient before, and he wasn't like this. So what I did is like, hey, what's up? What's going on? I heard like you're screaming. Is there something wrong? And then I told, and he told me like, well, I'm kind of suffocated in this hospital. I've been here. I want to go home. And then but they keep these people, just these doctors, they don't want to let me go home, they don't want to discharge me. And they said, well, we're doing the best that we can because we want to make sure that you feel better and you recovered before you can go home. And then, but is there anything I could do right now to help you? And, and then he said, he opened up and said, well, the truth is I feel so suffocated here because it's like he's claustrophobic. So being in the hospital, and then the windows are closed there. So he feels like claustrophobic. So he said, I cannot breathe. I feel like I feel so suffocated. So I said, so at that time, here's what can I do? Let me talk to your primary nurse, which is my nurse preceptor, and we'll see what we can do for you. So I talked to my nurse preceptor and talked to her about my patient concern. And then he said, well, my nurse preceptor said we cannot do anything about it because he's not allowed to go outside. So what I told my nurse preceptor, is it okay or is it safe if I just wheeled her around on his wheelchair and I will accompany him, like just looking at the window, because on that hospital we have like a big windows looking outside, and maybe that could help him just like see a different atmosphere. And then so that's what we did. My nurse preceptor helped me get the patient safely to the wheelchair, and I walk around the patient around the unit, and he was like saying, this is so much better than inside my room. So I only have my roommate who's not even talking. And I said, and then he was actually after that one, he feel much better, and then he's even more cooperative taking his medication. And he was actually very thankful to me because a while ago he was doing this screaming thing because he keeps pushing the call light, but then nobody like really listened to him. Like they always ask him, well, what do you need? And then but he cannot really open up what he really needs. He just really want to go out. So I'm glad that I listened to that patient, and I learned from this situation that being an active listener and being make sure you also assess what your patient needs with no judgment, you can help the patient to be compliant and cooperative with their treatment. And that's what I've learned from this situation.
I love that. I love the last sentence too about no judgment and like helping them, to strategize with them a way that they can get the care that they deserve. Yeah. Also ask sometimes, especially for peds, tell us about a time when you provided family-centered care.
I don't know if this is a better example, but I will tell you. I have two actually, but I'll share you this one.
Okay.
So I have a patient who came in who came in, and
Mhm.
then she's actually she came into because she has a thing, and then she came in with his brother and his mother because the patient, and then as we provided care and we stabilized the patient, I noticed that the the mother of the patient and the brother was like really uncomfortable on their chair, and it's like, and then the mother is always like doing this, and because it's always very cold. So what I told them, are you okay, ma'am? Do you need anything? Do you want me to provide you a warm blanket? And then they were actually wanting to have a warm blanket, but they're just so shy to ask one. So
Mhm.
I took the initiative to ask them if they want one, and then I provided it to them, and then they were very thankful, and then I even asked them because we had a little coffee machine in the I even asked them if they want coffee, and yes, they said they were very thankful, and I made them coffee. I even provided them some cracker because I believe that when you take care of a patient, it's not only the patient, but you also have to be supportive and take care of their family, especially there also can be an added support on taking care of your patient. So
Yeah.
that's why I did.
Yeah. Okay, perfect. Tell us about a time when you communicated something and the message was not received correctly.
Oh,
So you talk
uh-huh.
about closed loop communication and some lesson that taught you that.
Oh yes, close communication. Oh, so this one. Um, and when I was, so they actually asked me to get a blood culture sample for a patient who's have a at that time.
Mhm.
So my mistake with that one is that when I was doing the blood culture, because that was my first time to take a blood culture. Oh, sorry. The question is me be sending the message, or them sending me a message. What was
The way that they asked this nurse was, tell us about a time when you communicated something that wasn't received, but the other way around is fine too.
Oh yeah,
Yeah.
because what I did on that situation, because they asked me to do a blood culture, and I was so excited to do the blood culture, and then the nurse, my nurse preceptor, told me to wipe the blood culture with alcohol swab. So that's what I did, but I didn't know that I should use like a separate alcohol swab for both the aerobic bottle and the anaerobic bottle. So what I did is I swab it with only one alcohol swab, and then my nurse preceptor noticed me. What are you doing? You said I have to wipe it with alcohol swab. Yeah, but you have to wipe it individual with the individual alcohol swab. Oh, I'm so sorry. I didn't know that. So what I did is I corrected my action. I took a different alcohol swab again and re-swab it. But luckily, my nurse preceptor cut it right away, or else I have to draw the blood culture again, and that would be cumbersome for my patients. So I learned from this experience that uh, you have to make sure you communicate something to your nurse preceptor, or who is experienced who is experienced than you. So at that time, I know I was so excited to do things, but I should have cross checked with her. Like if she asked me something, do you mean that I have to swab it with one or two? I should have said that. So at that point, I that's a learning experience from me. So I always make sure every time I do something that I'm unsure of, I always ask questions, confirm, and for example, if I'm already done doing it, I will always close loop communication. I will always say, okay, I'm done taking the blood culture. I already sent it to the lab. So make sure that everything is on the same page.
Okay. Okay, perfect. And I love that you said the word closed loop communication, right? Next, I will do this. Is that correct? Especially, anytime there's a critical situation where you need to take a verbal order from a doctor, especially if it's about a medication, to always verify, I heard this medication in this amount. Is that correct? Yeah, closed loop communication is so important. So you can use this. You can also say that as you were listening to your preceptor, you also had the policy and the procedure in front of you. Do you want to use this for when they ask you, tell us about a time you made a mistake?
Yeah, actually made a few, quite a few.
I think you can, and then
Mistakes.
the difference of it, instead of talking about closed loop communication, you would talk about how you're really grateful when someone with experience is willing to go out of their way to share that advice with you to help you be more successful in your nursing journey and to help you keep your patients safer. That you know it can be difficult to have to give someone constructive feedback. So when someone does that for you, you're super appreciative.
So I can use this for the mistake example.
Yeah. They might ask you like another question, like tell us about a time when you got constructive feedback from a preceptor.
Can I use that example? The one that when the I should
Maybe
make
have
another
you
one.
can totally like if they don't ask the mistake one, but maybe have a separate one like they told you to work on your dexterity, or they gave you a tip to help with your time management, like help you balance like spending time with the patient but then also knowing how to still stay on track with your interventions or something. Maybe they coached you how to give a better report or something like that.
Well, I have this one. This was during so I was doing the IV insertion for my patient, so I could draw blood for the lab works, and also we can use that access to give medication. So one time, because I was still not that confident with my skills, so when I inserted the needle on the patient's forearm, so I think my angulation is wrong, is incorrect. So I put it very steeply. So I should have just lowered it down a little bit because so what my nurse preceptor did is like so he told me like, okay, I'll take over for this one for you. And then after finishing that IV access for my patient, and my patients move on, so she pulled me aside and told me about it. Well, I know you're very eager to learn, but I think you need to work on your angulation, because that is the wrong way. Because you might poke the, like go through and through when you put the needle. If I put it too steep, I can push the needle through and through and miss the vein. So, and I said, actually you're right. I told my nurse receptor, actually you're right. I should practice more. And but is it okay if you show me like how's the proper way? It's like, so we took out another extra set of IV, and then we practiced on a like IV tube. So I practiced how to properly insert the IV there. And then also my school provides an open lab. So when I don't have any clinical, I always attend the open lab every Monday, and I practice on the mannequins right there. So I took this opportunity, this constructive feedback, so I could improve myself and my skills. And I think I can use this as a new grad nurse. I can show to you that the nurse that you see right now is not going to be the same nurse that you're going to have in the future if ever you hire me, because I've committed myself to improve every time, and I'm very receptive to constructive feedback.
They could ask for a time that you had to give constructive feedback. So what a lot of people do, they'll double up for this question. So they'll talk about a time that because it makes you sound like a leader, and it's kind of similar to in the future, if you're a preceptor, if you can talk about a time when you had to train another employee. And so, talking about how you noticed that they were struggling with something, so you offered them support, and they had a much easier time after they were able to make the small change that you suggested. And your leadership style, or your style when you have to give constructive feedback, is to just come from a place of support. Make sure that they feel that you're approachable, so they can always come to you if they need help.
There was a time when I was a registered dental assistant on my previous work. I was like a lead RDA. So I was the one who's actually training the newly hired RDA at that time. So I was training this new dental assistant. I was teaching him how to do the x-ray, how to set up the operatory room, and how to also sterilize instruments. And then I know, especially during the first day, and especially if you're new to one place, you're kind of overwhelmed with all the information, like your brain is overloaded with information. So I noticed that she's kind of like just right there, like accumulating all the information. I'm just giving it to her, but I'm not sure if she's really getting all of the things that I'm teaching her. So I paused and I told her like, do you have any feedback for me? Like, am I teaching you correctly, or is there any way that you want me to slow down, or do you want to take notes or take a picture of how the tray or the operatory room is set up, or do you need to take a break? So I told her that, and said, "Oh, thank goodness." Thank you for asking me that. She asked me because she's kind of feeling overwhelmed because there's too much information to take. So we paused, and I realized on that experience that just like when you act as a leader, or when you're training someone, you make sure to ask questions. You're not just like blurting out information for them, because sometimes it's very hard. So asking information, I was able to assess her needs and assess her learning style. So in that way, I would be able to support her and then maximize her training. So at that time, when so what I did, I always asked if she's okay, and if she needs anything, and I'm always be there to support her, because if she's already done training, I'm gonna be also doing my own work, and she's not gonna be always relying on me. So I told her, if there's any question, always ask questions from me, and if there's anything you need, I'm here. And then, even though she's already good at everything that she's doing, she still have some questions that she always asks me. So I think that's a good thing, because as a new grad nurse, leadership is very important. Like, not just leadership, but good communication, and like working as a team. Because even though you're busy, you always have to make sure you also provide support, especially to those people who are new in the environment. So I think that's also a very good experience that I can bring forward.
Oh, okay. I love this. Because you're going for ICU, you should have 2 stories that talk about when you saw something critical going on and how you escalated it, and the interventions and the workup that you were able to get from the doctor. So they might ask you directly, like, tell us about a time you had a patient that was critical, or you had to tell us about a time you had to act quickly, or you had to make a change in the plan of care. Or if they don't ask you, you have to find an opportunity to squeeze it in, because let's say the other candidate does and you don't, now they have the advantage, right? So you have to find your opportunity. When you see it, you take it. The opportunities you can take are like, tell us about a time you had really great teamwork, or tell us about a time that you advocated for a patient. And really common examples are like, if you ever had someone who had low blood sugar, maybe they were having trouble breathing, maybe somebody fell, seizure, so maybe somebody, you were wondering, are they having a stroke? Their neuro status is a little bit different, and you had to do a stroke rule out, really, or chest pain, really anything where it was concerning and you had to work it up, starting with vitals, asking them, assessing, and then letting your preceptor and maybe rapid and the doctor know, doing any kind of like repositioning changes or putting oxygen or anything you could do without an order. Make sure you get a good IV, whatever you can take credit for. And then what the doctor ordered and what the workflow was that you did to work it up, and maybe the outcome, if the outcome was something you want to talk about. But yeah, you should be ready with 2.
Yeah. So, first, I have this patient when I was on the floor. So she was admitted for, and then at the first 4 hours of the shift, she's really stable, and she's really doing good. Vital signs are stable and very alert and oriented. And then on the second mid shift, and then I was about to assess my patient and assess the vital signs. Entered the room and asked her, but she looks not okay. Like, she just feel like a little bit of she looks anxious. And I asked her, "Are you okay?" And she said, I kind of feel dizzy when I'm sitting up. So that's kind of alarming for me. So what I did is to assess my patient. So I took her vital signs, and then the vital signs temperature is 101, but she has like this temperature when she came in already. And then blood pressure is 102 over 80. Respiratory rate is 24, and heart rate is like on 10, I think 100. Is it 102 or what? I have to check on my notes. I have my notes here, my journal. So, and then, so I remember on my nursing school, that when your patient has an infection, and then you have like this serious criteria, so I know something's wrong, and then my patient's complaining of dizziness. So I immediately called my nurse preceptor and told her about my patient's vital signs, and I told her also that my patient is acting and because I also asked for the alert and orientation, and she's kind of like, she's on and off confused about the date and the place. She knows her name, yeah, but she's kind of confused at the date and the place. So I called my nurse preceptor, and then she said, I think there's something wrong. So she took the the manual blood pressure and rechecked my blood pressure, because we don't know if that's the accurate one in the blood, in the automatic blood pressure. So she took it in, and it's the blood pressure in the vital signs monitor is 102 over 82, but then when she took it manually, it was actually 92 over 80. So what we did is like called rapid response, and then we also paged the doctor that the patient that we are concerned that the patient might be septic. So what we did while we were waiting for the rapid response, me and my nurse preceptor, she guided me to get another IV access for my patient, and then the rapid response came in, and then they said, we just infused the IV fluid bolus first, 1 liter, and then luckily she's the blood pressure is coming up, trending up, and then we also called the doctor, and then the doctor said she'll be right at the bedside, but make sure we take the blood culture first. So we also took blood culture for the patient, but luckily we were able to stabilize her, and we don't need to move her to the ICU. And then my nurse preceptor, that's a good catch, because if I didn't tell her about that, if I didn't spoke up for that patient, I could have been she could have been into shock, and she could have been transferred to ICU. So I think that's the time that I did advocate for my patient or think critically.
Okay, perfect. Let me tell you like other bits. Maybe you're gonna think like, oh yeah, we did that. I can talk about that. So typically the workflow for sepsis is they usually do a lactate, usually like a
Oh,
BBG with lactate. Sometimes they do the CBC, so that you have your WBCs and you have your neutrophil count, so you can see like, is it trending up? And
actually,
then
I forgot to mention that we did the CB.
yeah, I'm sure you guys did, because it's like a very standard like order set. They'll do usually first they'll have you do cultures, and then the fluids, and then broad spectrum antibiotics, and maybe like a Tylenol. And if the fluids don't bring the blood pressure up, they'll do like an albumin or something. Because if they need pressors, they'll go to the ICU. But so for the cultures, they might do they'll do a chest X-ray to see, is it pneumonia. They'll do a urine culture, maybe a sputum culture if they can produce that, or if they have like a JP bulb or a wound, they'll culture that. Blood cultures, so central and peripheral blood cultures if they have both. And then once they send the cultures and have like the lactate, the WBCs, all that, they'll usually do the fluid bolus, and then after that they'll do broad spectrum antibiotics. And then once the cultures result, they might be able to see like, oh, it's growing this specific pathogen, and they'll test the pathogen against different antibiotics, and maybe they'll find a more specific antibiotic that they can narrow the antibiotics to. Make sure you say like you put a bed alarm just in case she might be dizzy so she doesn't fall. Did you check, maybe you checked a blood sugar because she was a bit lethargic?
Oh, yeah. I think my nurse preceptor did that, but I did not do that.
If you and your nurse, it's not like she's going to stand at the wall with her hands behind her back when something critical is going on. So like you are like one person with your preceptor. So if she did it, you can say, we did it.
Did it? Oh, we did it.
Yeah. And then did rapid hang the fluid without the doctor's order?
No, we paged the doctor too.
Oh, okay.
He also paged the doctor.
Perfect. And it's a good learning opportunity of like, even though you're new, if there's a change from baseline, like you should trust yourself to know that you should work this up and escalate any findings. Yeah, so you could tailor this to like, if it's about teamwork, talking about having the nursing assistant grab the glucometer, and you're talking about all the different moving pieces, right? So you had rapid, the doctor, the charge nurse, pharmacy to rush verify the antibiotics, so there wouldn't be a delay in care. So talking about how it was such a great experience seeing what looked like sort of a calm environment, but everyone had a very specific role that they were doing. And in that way, it was great to see how quickly care was coordinated to stabilize this patient so that they didn't need to be transferred to the ICU. Or, if you talk, you know how to talk about like the advocating piece. I feel like that would be, you'd be able to do that. Cool. Do you have another one just in case?
Yeah, I have one. This happened. So me and my nurse preceptor are the break nurse. So we're breaking this nurse, and then my nurse told that nurse told me before she took a break, can you bring a warm blanket for my patient? So I went inside my because my I think the her patient is asking for that one, and she's about to take a break. So I went in and I was about to give the warm blanket, and then I noticed that my patient is saying something to me, but I don't understand what she's saying. So I noticed also like on her right side, the right side is like droopy. And then I asked her, sir, are you okay? And she just keeps saying, but she's kind of slurred speech. So the back of my mind, we didn't hear any report that this is her space line. So I know something is wrong. So I did a quick neuro check. I asked him to smile, and then this right side is really not okay. Like she gonna show teeth. So immediately I called for my nurse preceptor on the call light, and then I also asked for the charge nurse, and then they came in. And while waiting for them, I also because at the back of my mind, I'm not sure if this is stroke, but I know something is wrong. So I grabbed the glucometer and quickly checked the blood glucose, but the blood glucose is 120. So as my nurse preceptor came in, she also did her own evaluation, and then she also suspected his stroke. So said Paige does a stroke. So while waiting for the stroke team to come, me and my nurse preceptor, we did like IV access for my for that patient because that patient's only there, so they didn't really. So only has like one IV access. So we did the IV access while waiting for the stroke team to come. We were able to get the some blood works going on. So the stroke team came and then they did their evaluation and they said we have to immediately bring this patient to the CT. So we transported the CT. Me and my nurse preceptor went with them, and then they found out that the patient has a ischemic stroke. And then they see, and then I remember that the neuro doctor there was worried that it is a massive, it's like a large vessel occlusion. They said so. They did also a CT angiography. So while we're on the CT scan room, we're also monitoring the blood pressure and all the vital signs. And the blood pressure is high, really. It's like 190 over 94. So once they're done with the CB, we bring back the patient to stabilize him. But we cannot. The doctor ordered the pharmacy because on the stroke team there's already pharmacy also included on that team. But then we cannot really hang the altiplase. So because we need to lower down the blood pressure of the patient, so the doctor ordered us to like give labetalol for the patient. So I believe we gave 2 bags of labetalol, two medication, the labetalol, until the blood pressure dropped. So luckily it dropped into 165, and then we were able to give the patient the altiplase. And then at that time, everybody is doing their own work. Me and my preceptors also very calm, very calm that time. Well, me inside the I'm scared. Yeah, but I just calm myself, and I just make sure that if there's anything I have to communicate with them, and also act as a runner, like if they need something, I'm always there to grab it. And so I think, yeah, that's another story where I escalated the situation because I know something's wrong with my patient, although I'm a student, and I also like have to think critically no matter how nerve-wracking is the situation. I have to calm myself and make sure ask for help. If I don't know how to do things, always ask for help because we're a teamwork. Teamwork makes the dream work for the patient.
Don't get cheesy on the end. So
Yeah.
I don't know if it's gonna be any part of this will be Zoom, but just so you know, sometimes your computer shakes a little bit
Oh yeah.
or your
Yeah,
something.
sorry. Yeah, it's
Um
my laptop.
it's not terrible, but just like if you were in an actual interview, that might be something that they'd notice. It's perfect. You don't need to change anything. But just know when you are talking about the story, your voice, like your speed of your delivery is faster. So I'm like
Oh,
I'm like
sorry.
on the edge
If
of
I'm
my seat,
nervous,
like what
I
happened?
speak
What
like
happened?
that.
What happened?
I just
It's not
yeah,
like
I just have
super
to slow down.
noticeable, but it happens.
Sorry.
It's an exciting story. I get it.
Yeah.
These are amazing. I love this. What if they ask you, tell us about a time when you provided culturally competent
Okay.
care?
Oh, I have one. So
Okay.
this happened also. So this also happened. So this patient came in because but actually nothing really major happened to her. But then the only thing that is unstable with her is that her blood pressure is up. So we have to give her propranolol. So but the patient's always refusing the propranolol. And then so one time on that day, it's like asking, well, I need to take a meal, I need to take a proper meal, but that's already like 12 midnight, and the cafeteria is already closed, so we weren't able to order proper meal for her in the cafeteria. And my nurse preceptor offered her, well, we have crackers, but he said, but she started crying. So she said, the cracker is not enough for me. So I kind of feel bad for her. So I like to sit down, offered her tissue to wipe her tears because she's really upset and she's crying, and asked her, well, ma'am, the reason why we need to give you this medication, and it's very important for you to take this medication, is to lower down your blood pressure, because right now your blood pressure is high, and we don't want you to have any complications like stroke, because that may happen. So she said, I'm sorry, I didn't mean to upset you. I don't want to upset you, but it's just like, this is a cultural thing for me. In my culture, I need to eat something before I take medication. So and that cracker is not going to be able to fill my stomach. That's what she said, and I'm afraid it's going to do something on my stomach. So I think that's a cultural thing. So I remember that on our fridge we have a sandwich, and then I offered her, well, ma'am, I have a sandwich. Would that be on the fridge? Is that you think that would be better for you than the cracker? And then her face lightened up. I said, oh my goodness, Mia, thank you so much. Like, that would be better than the cracker. That would be able to fill my stomach, and that would protect my stomach. Because that's her thinking. Like, she thinks that the cracker will not protect her stomach, and then the sandwich. So from this experience, so I was able to give her the sandwich. And after eating the sandwich, she was able to take her medication. But what I learned from this experience, like how listening to your patient, making sure like don't assume judgment, because I didn't know that the reason why he wants to refuse the cracker, take the medication, is because it's a cultural thing, because he thinks that the cracker will not protect her stomach. So being able to like listen to them and make sure that I also respect their preference, because this is a cultural preference for her. I was able to make compromise with her, so he will be able to be more compliant with her medication. So I think it's very important as a nurse, no matter if you're a new grad nurse, experienced grad nurse, make sure that you also respect your patient's cultural preference.
I love this. They could ask you, where do you see yourself in 1 and 5 years?
Well, in 1 year, I see myself finishing the nursing residency program, and hopefully I'll be able to also take some like certification needed for my specialty unit. And within 5 years, I see myself that I solidify my skills and my nursing skills and knowledge, and I'm hoping that I will be able to become a preceptor to my fellow new grad, like so I could like give back to them, and maybe also be a charge nurse, or maybe even join a committee like that is needed for the unit.
Perfect. 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 So hobbies and self-care. The hobbies part, it's sort of your opportunity to form like a cute connection with them. Like, for example, there was a girl who was hired at, and for this question, she answered that her mom is a nurse. So sometimes after her clinicals, when they're stressed out, they'll come home and they'll turn on the karaoke machine, and neither one of them can sing very well, but it's just like really good for like regulating their stress levels. And it's just something that's like kind of cute. So that you want to say something kind of cute like that for your hobbies. And then for the self-care, I think they kind of want to know that you are aware that, while nursing is very fulfilling, there are sometimes very hard days, and that you have a plan in place so that you can, reflect on the day and kind of frame it in a way to yourself that lets you, come back stronger, learn from your mistakes, and to really be able to come back and give your 100% because you were able to take care of yourself. So I think they kind of want to know like that you understand that and you have a plan. So they'll say,
Yeah.
can you tell us a little bit about what your hobbies and your self-care practice looks like?
Yeah, my hobbies is like doing fishing and crabbing with my husband, because there's something about ocean, like really it calms our mind, and takes I think also it helps us about patience, because when you crab you have to wait. So but there's something really nice, and we enjoy that with not just my husband but with the entire family. So sometimes we bring our own barbecue there. We grill pork belly and
That's
some made some
amazing.
ramen. It's really cute. We stayed there until like 12 midnight until we're already tired, then catch a lot of crabs. So that's one of my hobbies. And for self-care, I like having massage. Like I go to massage to there's like a one cute place near our area. So maybe after a very tiresome job, I always go there with my sister and we enjoy the Thai massage there. And I believe that self-care and having hobbies can help me like de-stress, especially if you're in a work environment where you can easily be overwhelmed with a lot of work. It's very important to have this balance. And I also believe that having compassion does not just extend to patient, but having compassion is also having compassion to yourself. So loving yourself so you'll be able to love or care for others. I think my strength is like my ability to listen, especially to my patient, especially when talking to patients. Some of my patients said the most frustrating thing that they experience is when they felt like they're not listened to. So I think that is one of my strength. My other strength is that my ability to work in a team. I'm a very good team player. Not only that I am very accountable with my own job, but I also make sure that I also offer support, especially if when I see my colleague is drowning, I always jump in willingly and give them help. I offer help. And another thing is that I am very coachable and also I'm very receptive to constructive feedback. I always make sure that I use this constructive feedback with a growth mindset that so I'm able to improve myself and be a better nurse. And one more thing is I am very curious. I always ask questions if there's anything that I don't know, if I'm unsure of. I always ask questions. I'm never shy of asking questions, especially if I want to make sure that this is for my patient safety. So I always ask questions. And for my weakness, I think one of my weakness is that being a new grad, sometimes I feel unsure and I don't have that much experience compared to others, but I compensate for this weakness with my willingness to learn and making sure that I always study, and always make sure that I don't just focus on one thing. Make sure if there's a skills to improve on, I always improve myself. And yeah, for example, asking more experienced nurses so they can teach me so I could be efficient more in my work, because I know if you're efficient, you can improve the quality of care that you can provide to your patient.
You're so good at this. I feel like you should do my job.
No,
Like you're making this too easy for
you
me.
saw me like I keep blurting out things that I don't want to blurt it up, but just come out of my.
But they were cute though. Oh, another one. Tell us about a time when there was no right answer.
What do you mean by no right answer?
Right. Um, it can be, like maybe you had to decide, you had two patients that needed something at the same time, and you had to, and both were important, but you had to talk about your critical thinking thought process of why you chose to go to one patient first versus the other one.
Hmm.
Or if you had to delegate, maybe that was your answer.
Okay. So during my rotation, I have this patient. I have actually during my rotation, I am allowed to take two patients. So I have this one who has like he kind of he's having a he came in for a femur surgery. And then I have another patient who's also here, but she has a his ongoing chest pain before he went in, but now she's stabilized. So, but I think what I did there, because when I first came in, my first patient, the one who has surgery, when I came in for him to do my assessment and vital signs, he was complaining of respiratory distress. I mean, like he said actually his exact word is like, I'm having a shortness of breath. That's what he said. So something like, oh, okay. Are you okay? So I have him sit up because he said he's having difficulty breathing. So I have him sit up, and then I also take his vital signs. And then his vital signs is not good. Like his vital signs, especially what I specifically remember is the O2 sat is at 89%, and he's already on a 2 liters of nasal cannula at that time. So there's something wrong here. So I immediately assess his lungs, and his lungs, like, I cannot hear properly, like it's just like diminished breath sounds bilaterally. So I think like that time, like, oh, something is wrong with my patient. So I immediately call my nurse preceptor and my charge nurse, and they came in, and then they're suspecting that our patient is having like a respiratory insufficiency, and then plus the, like, they're thinking that because he has a surgery, he had an embolism, like a fat embolism. So we called in a rapid response right away. And because when we check the chest, there's like some scattered rashes, like petechial rashes. So that's really worried us. So we called a rapid response. We called the doctor to come to their bedside right away. And then at that time, my patient on the other the other bed, like, he's having also like a chest pain, but we know that's an ongoing thing. So we asked like a break nurse. There's a break nurse there to like make sure, just go if she could check on our other patient on the other room because she's having a chest pain. But we know that she's having that chest pain when she came in. But since our patient right now is something new, because before she doesn't have this. She's stable, just resting in bed. But right now she's having respiratory distress. So while all of this happening, I made sure that my patient, we grabbed we're looking for a non-rebreather, but we don't have a non-rebreather, so we have to grab the utility room. So we asked the one of the CNA there, the HSA, to grab the non-rebreather. While waiting for him, we just crank up the nasal cannula to 6 liters because she's already on 2 liters nasal cannula, just to like up his oxygen. So while waiting for the rapid response and then the non-rebreather, so when the nursing assistant came in with the non-rebreather, my nurse preceptor helped me attach it to the oxygen wall, and I placed the oxygen to my patient, and we crank it up to 15 liters. And luckily, the rapid response and the doctor came in, and then luckily the vital signs stabilized, and we don't the doctor don't need to like call for the intensivist to do intubation in there, because we rapidly like transport the patient to ICU for close monitoring. And from that time, I learned from the doctor and my nurse preceptor that she ended up having a mechanical ventilation. They intubated him, and they suspected that he has like the fat embolism during that time.
I can't believe you have 3 stories like this. You are a rock star.
No, just like luckily, it's like I think I'm just lucky, but
Well, the thing about if your shift replacement didn't arrive on time or at all, very unlikely that they'll ask this, but you just say you would tell your coworker to just get there safely. Their patients are being taken care of, and say that you would check in with the charge nurse and see if it's most appropriate for you to just wait until the nurse is able to get there, that you're happy to stay, or if they think it's more appropriate for you to give report to either the charge or, a different nurse, that you wouldn't leave until you safely handed off care. And then knowing that the nurse is going to feel a little bit behind when she gets there, that you would do anything you can to help her catch up, right? Make sure to do like either an extra bed bath or like help with the next med pass, and make sure the patients aren't like sitting waiting for their PRNs or anything like that. Oh, what if they ask about a time you had to be innovative or think creatively?
I don't know if this is right, but during the COVID-19, when we're doing the med-surg clinical rotation, we ran out of flush. So we ran out of the normal saline flushes. So what I did with my nurse preceptor is that we get like a sterile, the 10 cc syringe. So we just took one of the normal saline bag. We just pull the normal saline flush. I don't know if that's
This is
innovative
just in like the sim lab, or this is for patients?
for patient because we don't have a saline flush. Like we ran
And
out.
who your clinical instructor told you?
Yeah,
Oh, then
luckily
yeah, that's okay.
it's okay. But I don't
Yeah,
know if that's, yeah,
yeah, that would work for sure. And then just
or
talk about how,
maybe
like, especially with, the way healthcare is changing so quickly, to just be willing to be flexible and think creatively and find a way to keep your patient safe.
yeah, yeah.
So if we were to call your last supervisor or your last manager, what would they tell us about you?
So maybe my last supervisor will tell me that I'm very good working in a team. I'm a good team player. Especially I always make sure that I show up for the team. I don't really miss work. I always show up, especially if there's no emergency, unless there's emergency. There's emergency, of course, but I always show up. I always make sure that my colleague know that I am dependable. They can always depend on me. They can rely on me, especially making sure that we provided care for all the patient on time. And I am loyal. If you can see on my resume, like my resume, I've always stayed there for 6 years for my for my previous employer. So I am loyal, and I am also very punctual. I always arrive on time, and I was never late, especially not only on my previous work, but I also on my senior my clinical rotation, senior preceptorship, also in my school. I was never late because I think time is valuable for everybody, and also uh I'm a very receptive with constructive feedback, and I always have a growth mindset, and I can take this feedback in order to improve myself and not take it like personally, because I know that this constructive feedback is coming from a place that they're concerned because they want me to improve. And also, my supervisor may say that I'm hard worker because I really value work ethics, and based on my of all the work experience that I have experienced, I developed this strong sense of responsibility and accountability to make sure that your time, your money that you pay me is worth it.
Okay. Please tell us about a time when you found it justifiable to break a policy or alter a procedure.
Justifiable when I find it justifiable.
Yeah.
I'm not sure if I have that. Because as a nursing student, they always teach us to be safe.
Right. Which is what they want to hear, right? They want to hear that you would never, that you understand that the policies and procedures are evidence-based, and they have been made, slowly over time, by very hard-earned lessons of how to keep a patient safe. So you have a lot of respect for them and you don't alter them. What some people have been talking about is, like, let's say they had a patient and like they wanted to have a visitor, but like they had to kind of respect the COVID policy of the hospital. So they went to the charge nurse and then the manager and asked if it's possible to like switch the visitor or to do this thing. And sometimes it's like ultimately the manager said no, so you just try to comfort the patient as much as you can and maybe do like a Zoom call on the tablet instead or something like that. Or maybe they said yes.
Can I use your example?
Yeah. Yeah.
Yeah, because I honestly, I didn't have that experience yet.
I mean, good. I'm glad you're not just going rogue and breaking policy. That's the whole point. It's a trick question.
I'm kind of scared. Maybe I'm just gonna use your example. I had a patient who's she was worried about because she wants to go to the bathroom every time because she's having a GI bleed, and she always want to go to the bathroom, and then she's kind of like shy, like asking for help from the nurses because she knows that the nurses are uh as because she knows that we are busy too, like taking care of other patients. So she said, like, can my daughter came in here so she could help me, so she could help me go to the bathroom because she can go to the commode because she's just weak, but she can actually walk to the commode. And then so what we did, and then she's more comfortable like having her daughter right there, right beside her. But because of COVID, they kind of very strict for like the visitors to stay there overnight. But then the problem with this patient is that even at nighttime, she really need to go to the bathroom, and they even like gave her this pure wick so she doesn't need to stand up. And but then she said she's very uncomfortable and she's becoming more agitated because of that pure wick, because she's not comfortable, she's gonna sleep with the pure wick. So because of that, we asked the charge nurse if is it okay if we let the daughter stay there to help her until she fell asleep, and then after she fell asleep, she can just go back and go back the next day. So, but the visiting hours is only up to 8 o'clock at that time, so she needs to go. But because of that, because of the patient situation, we asked the charge nurse if we can bend the rules, even just extend the hours just for a few, until the patient can sleep and feel comfortable. So, like, luckily, my charge nurse agreed, like, to like, just for that patient, because she cannot really articulate what she want to say, but because she can understand a little bit of English, but she's not really yeah, that good with speaking. So what happened is that the charge nurse allowed, and then but they told us like not to tell anybody, because if we tell any somebody else, then everybody, they can say, oh, you bent this rule for this patient. So luckily, the our older adult patient was able to fall asleep, and then she was able to rest comfortably, and then the next day the daughter also came back and helped us with that patient.
Maybe talk about how it was for, clinical needs.
Of the
Yeah, no,
patient.
I think that's fine, because you did get permission from the charge nurse, who
Mhm.
maybe got permission from the manager, I'm sure.
Okay.
But then the only issue is, like, if another patient sees that, then they'll expect the same, for clinical needs, to keep the patient safe, to make sure she could not only not fall, but, make sure that she could get some sleep so she wasn't going to be at risk for delirium.
Yeah.
Yeah.
I hope they won't ask me that question. I
No,
don't.
that's a good one.
Yeah. But I
Yeah.
hope they won't ask me
I
that
hope they
question.
ask everybody so that you are the smart one with a good answer and everybody else is just like, I did a procedure wrong once. Does that count? What if they ask you, do you have a preference for day shift or night shift?
Well, I just really love to work so I prefer any shift. You can give me any shift. I'll be happy.
Perfect. What kind of unit would you most like to work on?
Well, I was applying for a surgical unit because this unit is very close to my heart, because my husband specifically has been a patient because he has like a heart surgery, like a valve surgery replacement. So surgical unit is very close to my heart, and I love working with a unit with a support culture, because culture. They're very welcoming, they're very supportive to their team, and they also celebrate diversity. I witnessed that firsthand when I was like doing my preceptorship.
Okay. What kind of support are you hoping for from your preceptor? Like, what can we do to support you?
So um I was hoping that my preceptor would be able to like be patient with me, especially as a new grad. I have a lot of questions. I had a lot of things that I want to learn. So I want a preceptor that is willing to help me, nurture me, and give me constructive feedback, so I could be able to continue to improve myself, and also like teach me the resources, because I know it's not all the time that my nurse preceptor will be there like forever. So I would love if my nurse preceptor could show me like what resources I need to learn or I need to do. So if ever in the future that I would need help from these resources, I would be able to utilize them.
Okay, perfect, perfect. I've been told that they've been like not doing questions at the end. So don't be surprised. Like, I don't know if they're running out of time or if sometimes they're announcing ahead of time they're not going to, but have a couple in case someone steals yours right before you're about to go. So you can ask things like, can you tell me about the patient population on the unit? What kind of disease processes you see most commonly? Or if I were to get the job, what would be the best way for me to prepare in the meantime? Can you share with us a little bit about the new grad orientation process? What are some of the current goals on the unit? Normally, whatever they say in the questions is like the meat and potatoes for your thank you note. But if they don't do questions at the end, you're going to have to be a sponge, and anything they tell you before, during the interview, anything they share, like, make sure you take a mental note, because that's basically all you're going to have for your thank you note of like, thanks so much for taking the time to meet with me. I loved so much hearing about whatever it is that they shared. I'd love to work in a supportive environment like that. I really respect that you said you value this, because that's also very close to my heart, and an important part for me, for part of my nursing practice. And it would be such an honor to be trained in an environment that promotes that. Thank you so much. Let me know if I can provide any further information. And they might not give you the emails of the people, because if a hiring manager from email got put on the internet, it would be craziness. So what you can do in that situation is you can email the HR person and say, like, I would like to send my gratitude to the people who took their time out of their busy day to email or to interview me. Could you please let me know, and like attach it, and please let me know their emails. And they might say, I'm not supposed to do that, but I can pass it along for you. Okay, so I feel like you are going to be really strong with the clinical scenarios. And I feel like you are probably one of the people that's watched all the clinical scenario videos in the list, right? Okay.
I did.
Okay.
But I'm not sure if I'll do a good job, but I did.
So what you can do with those too is you can push play and wait till it says, like, what would you do if you walked in and you saw this thing? Pause it and talk to your computer camera and say, like, I would do this, I would do that. Because it's easy to just be like, okay, I think I kind of know, and just press play. Like, no, like, stop it, say everything that you can think of, and then press play and see if you got everything. So you can probably practice like an extra hour just with that. And then the things they can ask you, tell me which of these things are probably going to be, we'll pick one, and that will be like the one that you feel the least familiar with. Respiratory, stroke, sepsis, seizure, bleeding, something else if you can think of something. It's like it was really difficult to be creative with this.
I was thinking, because I'm applying for a surgical unit. What do you think is like the most common complication? Should it
Maybe
be
like
bleeding?
because they might have people who are post like cath lab or something. Maybe we could talk about like a cardiac one. I don't think I have one of those in the video.
Oh.
So we'll just quickly go over your different kind of game plans for your different cardiac things. So like if they're in SVT, their heart rate's super high, you would want to first have them, obviously for all these people, take their vitals, ask if they're symptomatic, meaning like, ask them if they're dizzy, do they have any chest pain? When did it start? What does it feel like? Where is it? How would they rate it? All that kind of stuff. Put a falls alarm on them just in case they're going to be dizzy. Let them know you want to help them if they're going to get up. And then, you're going to do your vitals, make sure, as you're talking with them, making sure they're alert and oriented. And then you're going to, if it's SVT, your goal is, right, to slow their heart rate down to convert them back to sinus. You would first have them bear down. If that doesn't work, maybe invert the bed so that their head is down. And then the doctor will likely need to order either like metoprolol or adenosine. Worst case, they would cardiovert them. And then for like AFib, aflutter, they would also do maybe like metoprolol. And they might have to do like they might plan ahead, like that they're going to schedule them for like an ablation or a cardioversion or something like that. They'll probably put them on a blood thinner just to reduce the risk of blood clots. And then, because sometimes they have a clot, right? And because they're in AFib, and then they cardiovert them to normal sinus rhythm, and then suddenly the clot moves. So they have to anticoagulate them. And then for if they are Brady, they might need some atropine. They might need for you to put the pacer pads on, depending how low it is. And, like let's say they're in the 30s and they are losing consciousness. But go ahead, bring the crash cart in the room. Oh, so VTAC, you can have regular VTAC, like with a pulse, and then you can also have pulseless VTAC. You can also have PEA, right? If it's, pulseless VTAC, obviously follow your ACLS algorithm for that. Your cath lab people, they might have, a run of VTAC. So you would go in the room, take vitals, make sure they don't have any symptoms, let the doctor know. Any of these cardiac things, they're probably going to want electrolytes. So they'll want like a basic metabolic panel. If it's something where they have chest pain, They might want like a troponin or a BNP and a EKG, actually for any kind of, because if there is an arrhythmia, they'll want to catch it on the EKG. Making sure you have good IV access. Your post cardiac cath people or your post procedure people, you're going to have they're going to want you to do frequent vital checks and make sure they're not bleeding at the puncture sites. If they are, hold pressure. They're usually on bed rest for 6 hours after. And then after that, you take out their Foley. But anyways, all of that's going to be in the order set. They're not going to grill you on that. Yeah. Was there something in particular where you're like, it's a scary thing, or do you feel okay?
Well, yeah, I was listening to you and you're so calm. I was like, oh my goodness, I'm like Mary. I hope I could articulate all those stuff during the interview.
I'm still a rookie, actually. I'm still one of the babiest babies on my unit.
You're so good. I want to be like you. You're like, you're raising the bar so high.
No, that's that's gonna be you too. It's funny how it happens, right? You'll be like, oh my gosh, if this happened 1 month ago, I would have freaked out. And like, I guess I'm growing, right? Like every month it's like that. Even like as a new grad, it's like every week you're like, wow, like if this had happened last week, I would have cried and gone home. But I guess I'm getting stronger because I can handle this. This is okay.
Yeah.
And then you'll have days where you make a mistake and you're like, oh my God, I'm the worst. I shouldn't be a nurse. And someone will be like, no, you're an amazing nurse. Stop it. So that's where your self-care comes in. Let's start going through the specific ones. So they've been asking people, tell us about a time when you used evidence-based practice. And I think the easiest way to answer this is to talk about what you did in your research part of your nursing school. Like if you had a project where you had to do a poster or something. And then end it by talking about how you're really excited at the possibility of working in a hospital that really values evidence-based practice, because you would love the opportunity to bring more of that into your everyday work on the floor, with critical thinking and using evidence-based practice and really trying to do anything you can to provide individually the best quality care that you can for each patient, depending on their needs. Something like that.
This is hard.
Well, just so your project. So you did research about something, right?
Yeah, but we did two projects, but one is not really that successful, and one, well, we only reevaluated it once, and I'll just tell it to you, and then
Okay.
tell me if it's so. The first evidence-based project that we did, is like we research about this. When you go to the utility room with all the equipments, and sometimes the nurses won't be able to return the equipment right away on the original position. So what we did is that um, we took all the inputs of the nurses, like which equipment do they usually use most of the time. So we took a pictures and laminated those pictures, and we put it on each shelf. And also we put some of the laminated pictures outside the utility room, because sometimes on that hospital that I went to, like they have different utility rooms. And so most of the equipment are on this side and the other equipment is on the other utility room. So what we did is we laminated those pictures, and then we put it on the utility room, so they can just grab it right away, and also return the equipment there right away. And then after 3 months, we evaluated if our project works. But it's a mixed response. Some of them, they don't really care much, and some of them, they said it's very helpful because they were able to grab the equipment right away if they need it. But most of the time, not everybody is cooperative in doing that, because still some nurses are still putting the equipment on the wrong position. So I don't know if that's a good example.
I think it definitely is, because it's kind of similar to on the unit, they'll do like unit-based improvement projects. So it's kind of similar to something the manager would prioritize. So I think they're going to like that. And then the end sentence where you say something like, I really enjoyed the research class. It was really interesting being able to be encouraged to look at research about something that's applicable to the current work environment that I'm in, or current clinical environment, and being able to use the research to see how we can improve either the care or the work environment. And I am very excited about the possibility of working in a hospital like that would allow me to learn more about how to work with a clinical nurse specialist, how to look up the latest research to inform evidence-based care in my everyday work on the floor. I think that would just be such an incredible learning opportunity. Like some kind of thing where you're like grateful about it, but you're also saying like, does that and you're ready to help them do that. Like you're up to the task. Yeah. Okay, cool. That's usually really hard with. I'm glad we got through that.
When I was talking, I was actually like feeling nervous and I was shaking. Does it show on the camera?
No, no. And your smile is
I
really
was,
cute.
I was
So
like really shaking when I was explaining. Like,
I think they're gonna fall in love with your smile. Your smile is so cute. Another one that sometimes they ask about national patient safety goals. So I think the easiest one to talk about for this, have you ever done like a central line dressing change, like on a pick or something?
yes, I did.
Reducing central line infections is definitely one of the national patient safety goals, as well as reducing falls, reducing pressure injuries, reducing infection from the Foley from central lines. And I guess kind of the idea is like, yes, it's something that JCO is promoting as like something that needs to happen, but it's also the hospital really any hospital puts pressure like top down of, they know how much money it costs when the hospital causes a problem and harm to a patient and they have to pay out for all the treatment, all the damage, everything. So there's a lot of pressure from upper management to like at every level down to the units to improve the numbers, right? So last year, let's say we had 4 falls. We need to reduce that, hopefully to 0. The one that's most impressive, because the Foley one is more similar to like what CNAs would do, just in case someone else takes your answer, we'll go through Foley so you have that as a backup. So I'm just going to list everything that you could take credit for, and then you kind of build an answer of listing those things and saying what a great opportunity it was to learn from that your preceptor took the time to explain all the things that they do on the unit to prevent infections. So for a Foley, you could take credit for making sure the bag's not on the floor, making sure the tubing's not on the floor, making sure every shift that this Foley is still needed, going through the criteria and seeing, does the patient meet criteria for the Foley, or should we advocate to the provider for it to be removed? Because the longer it's in, the more risk it carries for a CAUTI. And another thing is, every shift, making sure the patient gets peri-care. So like the CHG, bed bath, making sure to clean in the peri-care area. And then either with CHG wipes or soap and water, usually. And then sterile technique for inserting the catheter, making sure to really follow step by step the procedure, the policies and procedures. And you can talk about how you really wanted to become more familiar with that. So anytime there was an opportunity to do a Foley, you've got your procedure, your policy and procedure back out and went through the steps so that you can just have it be something that you're comfortable doing quickly, even on a busy day, so that you're able to maintain your flow of your patient care. And then also same thing for if you had to take a sample from the Foley, right? So it's, I don't know what it is for, but usually you take an alcohol swab and you wipe the hub for 20 seconds, and then you take like a 20 cc syringe and pull out the fluid from the tube. Because if you take it from the bag, it's going to say like, yeah, there's a UTI, right? Maybe because there's maybe bacteria that's been in the bag, but from the tube there really shouldn't be. So using the proper technique to do that so that you're not introducing bacteria, following the policy and procedure. Making sure that it's always, the bag doesn't get more than 2/3 full, making sure that the bag is lower than the bladder so that there's no backflow. So if someone steals your answer for the central lines, use that kind of stuff for Foley. And so for central lines, a lot of it is very similar, right? Making sure that they have the CH, like let's say it's on their arm, making sure they have a CHG in the armpit area, preferably a full bed bath, but CHG wipe, every shift, making sure that every shift you go through the criteria of does this patient still need the central line, or would it be more appropriate to advocate to the provider for the central line to be removed? Making sure that you have the Kuros caps on each of the ports, making sure that your lines are not expired when you're drawing samples, when you're drawing blood samples, to make sure you're following the policy and procedure so that you're not introducing any bacteria. And then the dressing change, typically it's done once a week. So making sure that you're doing that in a way that prevents infection, and making sure you're also not accidentally changing the position of the line, that promotes skin integrity. And
I think
so
they will ask this during the unit interview, or they usually ask this on the panel interview. Because
I would say more the final. It'll probably
final one.
be only a handful of questions for the first one. Probably difficult patient, evidence-based practice, compassionate care, tell me about yourself, maybe like one other one. So let me know how your interview goes.
Yes,
And then
definitely.
yeah, let me know. And then let me know your draft of your thank you letter too. I can look over that. Is there anything else you wanna go over?
Do you have any advice for me how to calm my nerves?
Hmm.
Like the interview.
Even when you get nervous, you're cute when you're nervous, right? You smile, and like, so if you get nervous, it's not the end of the world. It's okay, like, to feel nervous.
Yeah.
Um, but um, yeah, like everyone there is nervous, and then the people doing the interview, they're just looking at the clock, just a person at work. You know how it is. Um, they're not, they're definitely not like being judgmental. And that, the problem is usually they like all the candidates. There's only like one or two usually where they're like, hmm. Um, and then it's when they have the list and they have to prioritize like which one they want, and send that in for approval. The ones that they don't want to cross off the list or move lower on the list are the ones that they really connected with, so if you're smiling because you're nervous, maybe they'll connect with you more. It's not like the end of the world, like if they feel like they got to know you, you got to know them, you treated them like they're just a human, and same thing. And because some people, they get nervous and they put up this kind of like professional wall where they use a very professional voice, and additionally, and that was a time when, and like they don't connect so much. I feel like you're really good at speaking professionally but then also connecting, which is like a very unusual balance. So you're in a really good spot. You interview amazingly well. Like,
Oh, thank you.
it has never happened to me before where I'm like, usually there's a few more questions that I want to get to and I'm out of time. It's never happened that I'm like done 3 minutes early. I'm like, I don't know what to do.
Thank you, Mary. This is very helpful. Actually, like I'm so nervous. I was trying to practice because what I honestly what I'm really feeling about this one is like because my English is not my first language, right? So when I'm speaking English, I still have to translate in my mind in my language before I translate
Mm.
it. So my major fear is that I wasn't, or I'm not going to be able to articulate what I really want to say.
Don't
And
worry about that. You speak really well.
thank you so much, Mary.
Yeah. Um, and so for nerves, I mean, I think the people that, so for my what I've noticed with this kind of job that I'm doing, and then also through my people that I know personally, like the people who are like, I need this job, I need this unit, like this is the one that has the most meaning for me, like I need it, they get anxious. And then it's, how like a dog can tell when you're anxious and they don't know like why, they just know when they think of you, they feel anxious and they're like uncomfortable. The people who are like, yes, it's great, but like I really just want to be put in the job where I like, I'm ready to help people, I'm ready to do some good, like just put me where I can do that, whether that's or whatever. Like I just trust that I'm ready to get to work and I'm going to be put in the job that can help me do the most good. Those are the people that get the job like really fast, because there's no like, they're not like needy about it, they're like calm, and they know, like, yes, they're nervous, but they know in their heart like when it's right, it will happen, and it'll happen in the right unit.
Yeah.
Yeah.
That's very helpful. I'll never forget that. I think what you said about I will be hired to a place where I will do most good. I
Yeah.
saw that on your Instagram, and that really resonated. And that's actually what really like make me like schedule this interview with you, because like
Oh.
that's exactly what I want to feel like.
Oh.
I want to apply for that interview practice. I can start schedule
Oh.
right away. Yeah,
Cute.
that
Very cute.
that resonates with me
It's
right.
true though. Like if you look, the people who get the job, it's the people who are like that. I don't know why. Let me know how it goes and send me your thank you letter for your, and I'll look over the draft, okay?
Thank you so much. Bye
Okay.
bye.
Bye.